Hi, my name is Rachel Allen, and I am a PhD student at the Alzheimer Scotland Centre for Policy and Practice at the University of the West of Scotland. And my PhD research is focused on young onset dementia and women's career development. Today, I'd like to offer a brief overview of my study, which is an updated version of the presentation I gave to the Women's Health Research Network in December 2024. Two key terms in this study are young onset dementia and career. Dementia is an umbrella term for conditions that affect cognitive functioning, for example, Alzheimer's disease. Dementia is something we generally associate with older age, but it's estimated that over 3,000 people in Scotland are living with young onset dementia. Young onset is dementia that is diagnosed before the age of 65, an age where many people are likely to be in paid employment, relied on in caring roles, and have comparatively good physical health. Defining career isn't straightforward because its meaning can depend on the context and individual's perspective. In this study, I define it as life and work because it includes the roles and activities that are important in our lives and the work, both paid and unpaid, that we invest our time in. Questioning the meaning of career helped me to decide to focus on women because both dementia and career are gendered experiences. To address my research aim, which is to critically explore how women living with young onset dementia experience life roles in the context of career, I interviewed 12 women living with young onset dementia online using object elicitation. Each participant chose an object to represent their career and tell me about it as we started. I have used reflexive thematic analysis developed by Brown and Clark to analyse the interview data. And I've used reflexive methods such as crochet to support this process. This picture is a crochet representation of my dataset. I wanted to create something tangible and touchable to represent the real lives and experiences included in this research. I'm currently finalising my findings and have generated two major themes from the data, the career tree and dementia peers and professionals, with 3 sub-themes each developed from participant quotations. The sub-themes for the career tree are working differently, making champagne and letting loose. This theme focuses on participants' experiences of leaving their paid employment and the lack of control they had over this process, and how they were able to move on from what was often a very difficult and traumatic period following diagnosis into new and enjoyable roles while living with dementia. Their pre-diagnosis professional routes facilitated new career branches after diagnosis. Dementia peers and professionals includes the sub-themes lifting each other, able to be honest, and all I'm worth. The focus here is on the people that facilitated career continuance. Using the metaphor of a pier that you'd find at the beach, this theme describes how peers supported participants to venture out further than the mainland of expectations of dementia would otherwise allow, but also highlights how sometimes medical professionals could be like a wobbly leg on the pier, having a destabilizing and negative effect. How peers were understood and defined varied and needed to be flexible, and participants needed the form and timing of peer support to be appropriate and reflect familiar career experiences. In conclusion, women living with young onset dementia have careers that involve change and challenge. Community, confidence, and contributing to making a difference in different ways are all positive elements of continuing career post-diagnosis. Thank you so much for listening. I'm happy to discuss further if you have any questions, and you're welcome to contact me by email, social media, or leave a comment below. Thank you.